afternoon, and thank you for joining us today at our media advisory. I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center EOC Director. And while the stay-at-home order lifted on June the 2nd, was lifted on June the 2nd, all other public health and workplace measures are remaining in place province-wide until Ontario steps into step one of the roadmap to reopen. Very pleased to hear that the province has announced we will move into step one as of Friday, June the 11th, as part of the roadmap to reopen. This is in large part due to the vaccine rollout across the province and the ongoing improvements in public health trends. And in a few moments, Paul will walk us through some of the details of step one, but at a very high level, Ontario will be allowed to have outdoor social gatherings and organized public events with up to 10 people. Outdoor dining with up to 4 people per table, with exceptions for larger households. Non-essential retail is permitted at 15% capacity with no restrictions on the goods that can be sold. And essential and other select retail permitted at 25% capacity with no restrictions on the goods that can be sold. Outdoor fitness classes and more that I'm sure Paul will get into are going to be allowable as well. So get those details from Paul in just a moment. Until we enter step one, though, on June the 11th, we will continue to see restrictions on gatherings for businesses and service and activities. Hamilton's vaccination effort continues forward at a significant pace. So 366,969 doses have been administered, and that accounts for about 66.8% of all eligible adult population being vaccinated, and 34.5% of the youth aged 12 plus have received a COVID vaccine to this point. So vaccinating community members remains a critical tool and a top priority in stopping the spread of this virus. So it's the best thing you can do for your community, for your family, to get us back to some sense of normalcy into the future, is to get that first and second dose as soon as you're eligible. Effectively this morning, in fact, adults age 70 plus and individuals who received their first dose on or before April the 18th, like my wife and myself, we can move up the second dose to an earlier date than the 6-week interval as the eligibility originally required. So we're really encouraged by the current numbers. Thank you to everyone in Hamilton who continues to do their part. Each vaccination moves us that much closer to a semblance of normalcy. So for more information, please visit hamilton.ca/vaccine booking to book your vaccine appointment. I will now pass it over to our Emergency Operations Director, Paul Johnson.
Thanks very much, Mr. Mayor. And as you mentioned, it's really good news. The more we start moving through these steps of reopening, the more it means that we're doing the things we need to do and seeing the trends in terms of the number of cases, alongside outbreaks, alongside all the other public health measures that the province has been talking about and Dr. Richardson has been talking about, all moving in the right direction, hospitalizations and the like. So I know people generally look at just that case number on a daily basis and have seen that steadily decrease, but there are a number of factors that are all going into the decisions to move through those steps. And moving into the step early means that a number of those indicators are moving in the right direction, which is indeed good news. But at a high level, what does moving into step one mean? Really, it means more outdoor activities for all of us. And so while we did hear about obviously retail opening up in very small capacities, the majority of the other pieces are around outdoor activities. And this plays in very much with where we are today. The encouragement is that outdoor activities are something we should be considering in order to break some of the isolation and break some of the boredom perhaps, and also getting some fresh air and exercise, although be careful with the hot weather that you take precautions as well. It's actually at that stage where too much exercise outside right now might cause other health problems. So we want people to do what they can outside. And that's really where we are also in step one. And so you heard the mayor talk a little bit about increased numbers of people being able to gather outside, up to 10 people. That outdoor religious services and ceremonies and other pieces now is really about being able to maintain the distance of 2 meters, not about a cap number on it. Also looking at the outdoor dining, which is great news for some of our businesses in this community, that day camps can start to operate, that outdoor and overnight camping at campgrounds and campsites, including Ontario parks and short-term rentals, can occur. But again, you hear a theme that it is about, in large part, those outdoor activities. So the push that I'll put on again is understand the new step we've taken, understand what is allowed under this step, and please contain yourself to those steps. This is not the time to continue to push the envelope. Indoor gatherings of family members in a social way is not happening. We're not looking at the widespread opening of all sorts of indoor activities. It is constrained to that retail area. And when you head to those retail spaces, depending on how small they are, it may be only 1 or 2 people allowed in at a time. So those are things to consider, and please be considerate to our businesses that are just trying to get back on their feet, but recognize at this stage, still very cautious about indoor gatherings. Those will come. As I mentioned last week in my update to our council, this step 1 also does allow the opening of outdoor pools and wading pools. And while that's wonderful, and some private areas might do that, or other entities might, the City of Hamilton is going to continue to open its outdoor pools and wading pools on the same schedule we would have in any other year in a non-pandemic year. So we're not delaying it because of the pandemic, but we are going to be opening our outdoor pools at the end of the month on June the 28th. And then some openings on July the 5th as well. And so for those wondering whether our outdoor pools will be available this weekend or the next couple of weekends, the answer is no. We will be opening them on schedule as we normally do at the end of June. So really, as the mayor suggested, the best thing to do is to head to either the provincial website. We will update this information on our website here at the City of Hamilton as well. And please understand the rules and the regulations, because I'll get to enforcement in a second, and we still continue to enforce the things that we are not allowed to do under the provincial orders. And so there's lots of new things to do, and I know people are going to be really excited this weekend. I haven't quite looked at the long-term forecast yet, but if the weather's great, I know it's going to be a great weekend for people getting out and doing what they can outdoors in very safe ways. So, as we also learned last week, we know that schools will remain in a remote learning environment and no in-person learning for the remainder of this school year, obviously to the end of June. And that puts a lot of strain and pressure on families and the children, of course, in their learning environments in the home. But I just wanted to quickly also recognize that for our crossing guards here at the City of Hamilton, this has been a start and stop kind of approach over the last number of months. And obviously they will be not returning to work because the schools are not going to be in person. We're really looking forward to having them all back and doing their very important safety related job as we head into September, which seems to be where everybody's focusing. Let's get back to school in bigger and better ways come September. So there was a lot of enforcement over the last week, and in particular on weekends, most related to things that are non-COVID-19. The waterfalls continue to drive a lot of our charges at the City of Hamilton, and it's again a reminder, regardless of the situation, please follow the signage when you're at our waterfall areas, when you're at any of our trail areas. And if it says don't go here, please don't go there. And we do have bylaw officers that will be watching for that as well. We have just a few charges that were laid for organized events or parties within residential places. So this is good news. People are starting to recognize that we're getting there. So let's just hold the line. Let's not have some of the things happen that we don't want to see happen right now. Let's make sure we continue to drive these numbers down, and we will be getting back to indoor and in-person gatherings soon enough, but we're just not there yet. There is one piece of enforcement that I know the media and the public may be interested in a bit of follow-up, and that is around Kryptonian Inc., which is a place that offers tattoos in our community on Concession Street. You may recall that they were continuing to operate despite the fact that they were not able to open. They are not a business which is allowed to open and still would not be allowed to open as of this Friday. But they continue to ignore our charges under the Reopening Ontario Act and continue to ignore additional suspensions that the city made around their business licenses as well. So we continued to charge, but also began to work with the Ministry of the Attorney General. And we always try and do as much as we can with individual businesses to get compliance in order without having to take more strong steps. But in this case, it was very clear after a growing level of enforcement locally by our municipal law enforcement folks that they needed to take additional steps, because allowing businesses simply to operate is not going to keep us safe in the way we need to as we move through this reopening. So working with our legal team and the Ministry of the Attorney General, we did explore what next steps. And today, the province shared that the Crown's application for an injunction under the Reopening Act restraining Kryptonian Inc. from operating a business was processed, and that order has come into force. And so this business is now being forced to close down. And I know that's an unfortunate situation, but it's happening because these are businesses where transmission of this virus is more risky. And there are lots of businesses that would love to have been open throughout this pandemic. We wouldn't have got to where we are today, where we're announcing, that the province has decided to move into step 1, and then 21 days later, hopefully into step 2, and then another 21 days later, hopefully into step 3. These are the measures that are necessary. They are hard measures, and it is not lost on any one of us that are sitting here today with you, nor the rest of the city of Hamilton, that these are tough times for businesses. But I am pleased that our folks have worked to make sure that there is going to be compliance from this business, because it simply isn't fair for businesses to skirt the rules and to remain open. And our enforcement folks take that very seriously as well. So as we move through these steps, there are businesses, there are opportunities that are not available to open up quite yet. And the answer and the imploring that I would have is just, hang in there. There is, hopefully just a few more weeks and more things will reopen, and then a few more weeks after that, and we will have some broad reopening in the province of Ontario. And that's ultimately the good news that we're looking for. With that, I'll pass things over to Dr. Richardson.
Thanks very much, Paul. So we have been in a good position, as you've heard from the Mayor and Paul, in terms of our case and outbreak activity trending downwards consistently now the last few days or so. So sitting right now at 20,874 cases, a net change of just 25 from yesterday in terms of increased numbers. And we're now at case levels that we haven't seen since February of 2021. Our 7-day moving average is sitting at 52, and our weekly incidence at 60 per 100,000. Our reproductive rate still sits at 0.89. Do want to highlight, though, that our percent positivity amongst those who gets tested is high. It's one of the highest rates in the province, just third in the province, and we're sitting at 6.1% based on the ISIS data that is put together. So that is still concerning in terms of the number of cases that are out there and the percent positivity. So we do want to continue to have people getting vaccinated, doing public health measures as we go forward. On the outbreak front, we have just 15 local outbreaks on our website, no new outbreaks to report today, and as well the size of those outbreaks continues to decrease. So we did have some larger outbreaks that happened at the beginning of May, but our magnitudes are now down to just usually 2 to 5 cases involved in each outbreak. And most of our active outbreaks right now are happening in workplaces and supportive housing. I do want to let you know that on our website, you're going to see some changes in the way that we are reporting our COVID-19 surveillance. So we'll be making transitions on our city's status of cases dashboard. The province is making changes to the way that they're monitoring for variants, and this is a good thing. It's going to help us to find additional variants as they emerge. And so they are now going to be sequencing 50% of all of the COVID-19 samples that are positive that come in across the province, and they're beginning that tomorrow. So this will give us better estimates of the prevalence of variants of concern, as well as variants of interest and other lineages of COVID-19 virus in Ontario. But it does mean that we will no longer be getting those screen results that could easily be interpreted as being, for example, due to the B117 variant and those sorts of things. So we're going to be unable to report local variants of concern or variants of interest in our status of cases dashboard in an accurate manner for the community. So you will see that change as of tomorrow. Those interested in the mutation and variant estimates can look up the Public Health Ontario weekly summaries that they're going to be doing as they go forward. So just remembering what we're trying to do with this system is to detect when there are changes in terms of the variants that are there. They will, it's something we need to do. We need to do as in a detailed fashion as possible, and to get estimates for across each of the health units, but we don't need to have the exact number of cases. It gets back to the pieces about trends and understanding what is happening. You'll remember that, in fact, when it came to managing all of the cases, when we first saw the emergence of the B117 variant back earlier this year, in fact, the way we managed cases very much changed, so that every case, every outbreak is managed as if it is one of the variants of concern, with very close monitoring, extra testing that is done, extra isolation measures that are required. And so while as we see the variants emerge, it is absolutely critical that we continue to get those vaccination rates up, to follow those public health measures. We don't have a concern about no longer having those details as to exactly how many cases are there. On the vaccine front, as of today, we've administered, as you heard from the Mayor, 366,969 vaccines, meaning that 2 out of every 3 Hamiltonians over the age of 18 have now been vaccinated. On the youth front, we're also making very good progress, with 34.5% of those 12 years of age and older having received a vaccine to date. So, the other side of these statistics is always who hasn't gotten vaccinated yet. So we do have over 30% of adults in Hamilton that have not yet had a first dose of vaccine. And of course, we want them to be protected. We want their loved ones to be protected through their vaccinations, and our community as a whole to be protected. So getting out, getting vaccinated is very important. And as well, it is key, as you've heard already today, in our progress forward with reopening. So to go into step 2 of the reopening plan, we do need to have 70% of Ontario adults vaccinated with at least 1 dose of COVID-19 vaccine, and 20% of adults vaccinated with their 2nd dose. So we really want to keep up that momentum in terms of people coming out and getting vaccinated. And so, call up your friends. We do know that one of the most influential things for people in terms of getting vaccinated is to hear from the people they care about, to hear from the people they trust about what they're thinking about vaccination and how it went for them. And so it is really important that you continue to talk about vaccination, share your experiences, reach out to people you trust, like your pharmacist, like your family doctor, and talk about any concerns you might have and how you can move forward. We do have no concerns in terms of supply, and the number of available appointments that we have has been really encouraging. And we were very pleased today to see that the province opened up to those that were 70 years of age and older to book an earlier appointment for their 2nd dose of the COVID-19 vaccine, as well as anybody who received their 1st dose of vaccine on or before April the 18th. So you can go in and book your 2nd shot to be earlier. You don't have to go back to the same place you were vaccinated at, although of course you could book back in. You could keep your existing 1st appointment too, if that's what you wanted to do. But all of the clinic options that are open to you through the province's booking page, you can book into any of those, or you can go onto a pharmacy website near you and book in through that route. So as we always say, the best vaccine is the first vaccine that you can get. So take a look at what is there and book in to get yours as soon as you can. You'll remember too that the National Advisory Committee on Immunization, or NACI as we call them, released their guidance on the interchanging of the different COVID-19 vaccine types. And so those who received a 1st dose of the AstraZeneca vaccine can get either a 2nd dose of AstraZeneca, or they can get a 2nd dose of the mRNA vaccine, the Pfizer or the Moderna vaccine, for their 2nd dose. So that is open to people as well. And you'll find as you go through the booking website, it'll take you through that process. Individuals who got their 1st dose that was an mRNA vaccine, so Moderna or Pfizer, it is recommended that you have your 2nd dose as the same vaccine. But if that's not readily available, then you can choose the other vaccine and go forward with that. And the province is going to be coming out with a few more details about that interchangeability in the next few days. We also talked about our youth vaccination strategy many times over the last several weeks, and we're very thrilled that as we move forward, there are several locations where young people who are 12 to 17 years old and eligible to get the Pfizer vaccine can get their vaccine through one of our large-scale clinics or through some of the pharmacy locations here in Hamilton. It's very comprehensive, and there are different types of clinics. There are special family-friendly clinics that are going to be running next week and the week of June 21st at Hamilton Health Sciences Wellington Street Clinic. These are available to book through the provincial portals, so we are continuing to use that booking framework. And these are special family-friendly clinics that include a separate area for youth and family, and they have additional supports there for the youth who may have some specific needs or might have some anxiety that's related to needles or pain, and so those special supports are there for them. As well, we have some pop-up clinics that are youth pop-up clinics that are operating throughout both rural and urban areas in Hamilton. There are 8 of those in total. These are in addition to the ones that our ministry colleagues from down the road have come to help us out with. These ministry clinics will be running as well at Central Memorial Recreation Center and Lake Avenue Elementary School this week. We have put those clinics in place in those areas of the city that do have slightly lower vaccination coverage rates and tend to have also higher positivity rates when it comes to their test results. So we wanted to, again, make sure there's lots of opportunities for vaccination that are there. Those, again, can be booked through our website, and we're really hoping to see people come out to those vaccination clinics as we go forward. As always, the information around vaccines can be found on our webpage at hamilton.ca/vaccine booking. And we encourage everybody to hop on to the webpage, click through to the provincial tool, book your vaccination. If you have any challenges with it that way, you can always call the provincial hotline at 1-888-999-6488. That's it for me, Mr. Mayor. Back to you.
Thank you, Paul and Elizabeth, for that great information. A lot going on in our community, both from the opening perspective as well as from the vaccination perspective. So we're getting there, folks, in terms of getting folks vaccinated. And again, reminder that the most effective prevention tool that we have is the vaccine. Beyond the masking and the physical distancing, which will still be with us for a while, but so will the vaccination process. And we encourage everyone to get the vaccine when it's available to them. Continue to follow the public health guidelines, though. I thought so. The masking and physical separating is still an issue. We cannot waste a year and a half of effort here only to see cases increase because we're feeling invincible. We're not there yet. And certainly there's a bit longer way to go. And I know people are gathering in small numbers and maybe thinking that we're out of it by now, but we're really not out of it until we get a vast majority of our population vaccinated. So let's look forward to that, and let's continue the good work to make that happen. So I'm going to turn over now to Jasmine, who's going to lead us through some media questions. Jasmine.
Great, thank you, Mr. Mayor. We have 5 media joining us today. As usual, we'll start with 1 question and 1 follow-up for each of you. First question will be to Lisa Pulaski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my questions today. This would be for Dr. Richardson. You did mention the test positivity rate being on the higher side compared to kind of other regions of the province. Just wondering about the number of people that are going to get tested at this point in the 3rd wave compared to earlier in the 3rd wave. You know, how can you comment on whether or not that's dropped significantly, and is that to be expected, or just what those numbers look like?
Thanks, Lisa. Yes, we have seen a decrease in the number of people who are going forward for testing. A lot of that was expected as schools went to remote learning, and so there wasn't as much need in terms of having testing related to being part of a school cohort. As well, we've seen decreases in cases, and we test our cases twice, or contacts of our cases, I should say, twice during the management of those contacts. And so as case numbers go down, the number of tests that are generated for that reason also go down. So they have declined, and hopefully that does mean that we still have all the appropriate people, anybody who's symptomatic, going out and getting tested. But we do continue to see this higher rate of positivity. So it's great that those that are positive are getting tested, but we do want to see that continue to drop.
Okay, thanks. And then my second question is actually for Paul Johnson. You did mention the Kryptonian ink piece and how there's going to be kind of further measures to ensure that they're actually, not operating when they shouldn't be. Just wondering about other kind of tattoo parlors or businesses in terms of whether or not they've continued to be a problem for enforcement, or has that one really just been the one that stuck out to enforcement officials?
This one has been the longest investigation, the one that, there has been no compliance with continued enhanced, I don't know what you want to call it, I guess enforcement by our folks under the different areas. So then they looked at the business license piece. So obviously they weren't going to comply under the Reopening Ontario Act. So we then looked at the business licensing piece and did some other pieces of work. So it's been the longest going issue for us from a bylaw perspective or a municipal law enforcement perspective. And we also, when we talked with the ministry, highlighted that this is clearly a business that cannot operate. There is no gray area here. There is no, there have been some other pieces where we're trying to determine whether it's providing physiotherapy or other types of pieces where you can have a larger discussion about why the business is open. In this case, it is clearly a business that cannot be open. There is no wiggle room here. And if that's what happens and we start to just allow that to occur, then forget all your steps and forget all your reopening plans. And so we're really pleased. It's a good indication too. Clearly the ministry said to us, you need to do what you need to do locally first. They're not going to swoop in as the province and start looking at all these very quickly. So we did a number of progressive enforcement pieces, but at some point we had to turn to them and say, this is actually your order. It's your piece of legislation, your law. And can you help us further enforce this with the business? And I would just say that, I highlight this because, at some point, people would know about it. So it was good to get it out there. The reality is, thankfully, this is the only one we've had this level at. All the other businesses in Hamilton, by and large, have done a tremendous job. And I want to say today that, the announcement about Friday is that first step towards the next two announcements as we move through step 2 and step 3, hopefully in those 21-day bans, that says we're going to see businesses in this community start to get back more to providing their business in all the ways that they would like to, some in person, as well as continuing, I'm sure, to do takeout, to do delivery, to do some of the other ways that they've found to deliver service, because there will likely be some restrictions in place for quite some time just to keep everybody safe. But it's that good news part of it. But clearly, we also want to say as the city, we take these things very seriously. We take them seriously because of the safety of Hamiltonians, but we also take it very seriously because it's unfair to simply say, well, we laid one charge and that'll be enough, and then have other businesses scratching their head and saying, we're doing the right thing. We're taking care of ourselves as best we can, knowing the pressures they're under and responding to the provincial orders. And yet, then they see another business just going on. There are plenty of businesses that would say to us, I really need to open yesterday. I needed to open a few weeks ago, and they haven't. So this is a way of ensuring that we stick up for the other businesses that are doing their part, but also that we keep people as safe as we possibly can. And the good news is that, in a number of weeks' time, we'll see most of these businesses reopening in some kind of format safely anyways. So that's the good news out of this.
Great, thank you, Paul. Our next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. Dr. Richardson, in addition to the high test positivity, Hamilton also has one of the highest case rates in the province. Do you have any idea why we're seeing high test positivity and high case rates despite, our numbers steadily declining here?
Thanks, Joanna. I don't think there's anything specific in terms of our particular area. We have seen that our outbreaks had tended to concentrate in workplaces and to some extent in childcare facilities and those sorts of areas that were still open. And so, that was explaining some of the transmission that we were seeing. But, as I said, things have been changing over the last several weeks, and that is good news. I think one of the things we want to make sure is that, everybody is getting vaccinated, and we are moving that vaccine out of our fridges just as soon as it arrives. So we'll continue to focus on that piece as well, and that will help to bring down case rates as well.
Actually, that leads perfectly into my next question, which is about vaccination. Hamilton has some significant pockets that still need to be vaccinated, such as 15% of those age 70 and over who've been eligible for quite some time now and haven't had a first dose. Do you know why, you're seeing sort of these little pockets that aren't getting vaccinated, and what can public health do to get them vaccinated?
Yeah, there are certainly some groups that still have lower vaccination rates. So you pointed out some of those that are older in that 70 plus age range have not chosen to get vaccinated. We've had multiple options in place in terms of getting people vaccinated, whether it's for homebound individuals or small clinics, large clinics in different places throughout the city, various hours that are available to people. And so as we go forward, we do know that the choice of whether or not to get vaccinated is, one that is very personal for each individual, and that they're very reliant on those around them and those that they trust, including their faith leaders, their, as I said, primary care physician, whoever it may be, that plays that significant role for them in their lives. That's a very important source of information for them. So we're going to continue to work with those sorts of groups and those sorts of individuals to help get out the word about vaccine. You'll remember we did a town hall with a number of family physicians just a short while, they were on our media briefing just a short while ago to talk more about vaccines and make sure that the vaccinations are happening in places people can access and that feel like a setting that is welcoming to them. So we'll continue to do that work as we go forward.
Great, thank you, Dr. Richardson. Our next question is to Phil Perkins from CHCH. Phil, you can go ahead.
Yes, what is the city's AstraZeneca stock right now? Because I've spoken to a couple of people who are preferring to get AstraZeneca as their second shot because they had it as their first shot. What's the inventory right now in Hamilton?
So the AstraZeneca vaccine, Phil, actually goes out through primary care and through the pharmacy channels. So at this point, I don't have exactly when there might be some more that is expected here. For those that are able to get it and got it through their pharmacy, the thing to do is call up their pharmacy and ask them when it might be available. As well, they can also, if their own pharmacy doesn't have any available, there are a number of pharmacies that are listed on the provincial website, and you can choose ones that have AstraZeneca and choose to go to those that may be nearby here in Hamilton or elsewhere. So as that supply comes through, people will still be able to get it and have those routes. And that's the best way to find out who's got it at the moment, is through that website.
And is the vaccine hotline still a viable, route to get your vaccine? Or because I know Hamilton uses the provincial portal, and it seems like we're going through an age and date of first dose kind of path to get that second dose, and not so much hotspots, which I understand the ones that Hamilton designated were on the hotline. So are all vaccines supposed to be basically booked through the provincial portal right now, unless you're going through a pharmacy and then you call them directly?
So when it comes to booking, the best route to get as many options open to you as possible is to go through that provincial portal and to find out where you can get vaccinated, which kinds of clinics are open to you, what the pharmacies have, all of those sorts of things, who that is that you can book in with. Now, if you're somebody who has not got a green health card or somebody who has challenges from a technology perspective, yes, absolutely, our hotline is there for you. If you're somebody who wanted to book in for those reasons, you can do that through our hotline if you have questions that are related to it. So it is there as a backup. It is there for those who have a difficult time accessing, but otherwise our clinics are all online.
Thank you, Dr. Richardson. Next question is to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope everyone had a good weekend. I know I got a little sun-kissed with all that heat. Anyway, my first question is for Dr. Richardson. I noticed the percent of people who are vaccinated on the city website, it never decreases. The percent of those vaccinated within the eligible population, like right now it's at 60-something%. And it never decreases even though new groups of people are becoming eligible. And I'm not really understanding why that number doesn't lower. So can you maybe please explain how we calculate the percentage of vaccinated people in Hamilton and the eligible population and all that?
Sure, absolutely, Bobby. So it's a very good question, and there's a couple of different arms to that answer. So the first is that the sort of standard that people look at is the percent of the population over 18 who have had at least one dose. And so since eligibility for that opened up a long time ago, and because that's kind of been the standard that we've looked at overall, that's why you don't see that denominator change and you don't see the number go down. It just continues to go up, even though booking change options do change. You'll see as well, as we go forward, we'll start to make some changes to that reporting, because what we're doing now is opening up to groups like the 12 to 17 group. So you heard today about how well we're doing with that group in terms of moving forward with vaccinations, and that number is in the 30% range. You'll see eventually there will be vaccinations that are available for younger age groups. So you'll begin to see us measure that piece. The other thing is you'll see us measuring who's getting our second doses. So we've talked about going into step 2 of reopening is going to require 20% of people to have their second dose of vaccine. So you'll see us starting to monitor what proportion of people have had also their second dose of vaccine. So that's why the overall number doesn't change, because it is based on everybody who's over 18, and our numbers continue to go up. You can't get unvaccinated, which is a good thing as we go forward, but you'll see us start to do some other measures as well that reflect the changes that are being made.
Thanks. And my second question, so variants, specifically that Delta variant, they're becoming even more concerning. Sorry about that. And we're not going to be able to now see the number of these cases locally. I mean, how is that not concerning?
Thanks, Bobby. And this is a piece that's really important to understand. And so from the standpoint of how we manage cases, we've been managing them all the same way since back in March, when the guidance changed around how we should manage any cases because of the variants of concern. And of course, the concern with these variants is that they are more transmissible or maybe more severe. And so that's why we need to be so strict in terms of the way that we manage them. In terms of what's going on and doing the surveillance aspects to understand what's happening here, we don't need to know that on a case-by-case basis, but we do need to know what the trends are. And so for some of these variants, we don't even have a test that screens for them, or the only way we can find them is by doing that whole genome sequencing. So what that means is it's a test of the genes, looking at the genetic sequences that are part of the virus and looking very carefully at them. And that takes a week or two to do. And so the province has shifted their way of doing surveillance to do that on half of the samples that come through. So it's quite laborious. It takes a fair amount of resources to do, but they're going to do that. And then they will let us know what they find. And so all of that information, the province will publish weekly for when those are updated on their website, and it'll keep us aware of what is happening on a province-wide basis. But since those summaries are being generated elsewhere, and because we don't know exactly when they'll get posted, that we're going to be directing people to go check out that website, see what's going on, see what the latest information is as we go forward.
Thank you.
Thanks, Dr. Richardson. Our next question is to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, thanks for taking my questions. My first question would be for Paul. So just on Kryptonian ink, I know the last time we had sort of discussed this, or I had reported on it, obviously the Attorney General had been involved, but was there any other progressive enforcement between then and now? Like, I don't know if you'd be able to tell us how many charges were laid or how often bylaw officers visited there, or did that sort of stop happening once the province had been notified? I don't know if you could tell us a bit about that progressive enforcement a bit more.
So the only piece I can comment on is the progressive enforcement is we also looked at the business licensing side, which is not something that's covered under the ROA. That's something we would more take on locally. And you've seen us do that before with liquor licenses for restaurants where there's been multiple infractions in the past around the pandemic piece or the COVID-19 pieces. So I don't know all of the timing. And yeah, at some point it became obvious that our enforcement was not going to do much. It was felt by the team that they had exhausted the local enforcement tools, and we had those ongoing conversations with the ministry about that. And so when we felt we had exhausted that, we took that to the Ministry of the Attorney General for them to explore next steps and to review the case from their perspective, because that's ultimately their decision as to what to do. We can certainly recommend, and we did in this case, that they step in, and they did. These are rare across the province. And so I think what you're seeing in this case is, as I mentioned before, it's clearly a business that should not have been open. There is no gray area. They were not trying to argue that somehow they were opening under an exception. They just chose to stay open, and their public comments were such that they had just decided they'd had enough, and they're going to continue to run their business. So I'm sure we can connect you with municipal law enforcement and they may be able to give you a bit more on the timing. But what I will say is we looked at the ways that we could progressively enforce locally through some of our other licensing means, and the team then just felt that they had reached an exhaustion point. And we also wanted to give a bit of time. Businesses often, when we continue to go, maybe think we're going to go away, and also give just a bit of time for the business to reflect. But clearly this business was not going to reflect on why they should close again and wait for the legal reopening under the Reopening Ontario Act. And so we just felt it was time to request that the Ministry of the Attorney General step in.
Thank you. And my next question would probably be for you too, Paul. Like, the injunctions, they are rare. I guess they've been issued against, I believe, the churches, the one in Aylmer for sure. Are you worried, or is there any concern that the tattoo shop might become some sort of rallying point for people who rally against COVID measures and so on? Like, is there any concern that this might, I don't know, cause any other further concerns with just like large gatherings that still aren't allowed? I don't know if there's been any talk of that yet.
No, I mean, that people may take whatever action they're going to take. I'm not overly concerned by that. And if it does become a point of rally for those, we've had all sorts of protests regularly throughout this pandemic on a variety of subjects against whether it's mask bylaws or masking descriptions or all those other pieces. So I don't think so. I think this was a business decision that certainly some people were supporting and others online, but we've taken action, the province has taken action. And I think what people need to focus on now is moving through those steps, but recognizing that just because we're entering into step one doesn't say, okay, let's force it and let's start doing step two things in step one, and I'm sure it'll all be okay. The answer to that is no. There's a progressive nature to these steps. Province has been very clear why. Province has been very clear that this is tied to some increasing activity, as Dr. Richardson said, around our vaccine program, and also monitoring what's happening in our hospitals, what's happening in our communities. And these are taken because otherwise you run the risk of having to go backwards, and we just don't want that. And I think if we take our time and just, as I say, we're talking weeks now. This is not a situation where it's months. That's what we need to focus on, and I hope the community can continue to focus on. And quite frankly, come Friday, let's rally in a way that we can safely and legally. Let's rally and support our businesses. I'm sure that's not going to be a problem if the weather's decent and the patios are open. I don't think they need any oomph from this threesome here, but let's get back to supporting businesses in the way we can safely, and that's where our focus should be. Not on what one business chose to do during a period when they shouldn't be open.
Great, thank you, Paul. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Thank you very much, Jasmine, and thank you again to our media partners for their questions and making sure they share that information with our community at large. Very much appreciated. And to Bill Custers and the entire team of Cable 14 and Clear Cable for helping us put these advisories together. Thank you so much for your efforts over the better part of a year and a half. And hopefully at some point we won't need to be doing these, but clearly there's still information to be shared, lots of information to be shared. And so booking your vaccine and when you're eligible is the best thing you can do. There are virtually everyone is eligible for a first dose if you're 12 and up. Second doses have some eligibility as well if you got your first dose prior to April the 18th, or if you are 70 plus. And I know many 80 plus folks have already taken their second dose appointment. And so there's lots of availability. And again, the best thing that you can do on behalf of your community, your family, your friends, yourself, is to get that vaccine so we can speed along the openings that we're also fond of talking about right now and looking forward to. So I'm sure I'm like you. I can't wait to go and enjoy some of the restaurants, both indoors and outdoors. But we're not quite there yet. So the outdoors is just ahead of us at the end of the week. And hopefully, if we get more people vaccinated, we can start looking at further openings as a result of the provincial reopening plan. So please continue to do your part. Obviously, the work is happening. The case counts are down, and that's the good news. And we need to continue that trend going forward. So thank you all for your great effort. If you need more information on COVID-19, the vaccine, the financial supports, anything else on related to COVID, hamilton.ca/coronavirus. Credible information there on all of those matters. And certainly I encourage you when it comes to the vaccines to go to credible sources to get your information so that you can make an fully informed decision from experts, not folks that pretend to be experts, but people that know what they're talking about when it comes to vaccinations, epidemiology, and ethics around vaccine. All of those are very important, very specific expertise. And certainly you should be listening to the experts on these matters. Please continue to follow all the public health advice on physical separation and masking. All of those measures work effectively as well. And we're going to come back here on Monday, June the 14th at 3 p.m. to give you another media advisory at that point in time. So in the meantime, take care of one another. Stay cool out there. It's frightfully hot, but we have the cooling centers open. So please, if you need that, avail yourself to the rec centers or libraries that have cooling centers in them. And we will see you in a week or so for the next media advisory. Thank you all. Good afternoon.